Okay, welcome back to Jason the PT. This is actually a follow-up from my last episode where I was talking about plantar fasciitis, Achilles tendonitis, and the lack of ankle mobility. A friend and colleague of mine asked if I could comment on plantar fasciitis as it relates to spinning and biking, and I thought I could do that. Now, I will premise that I'm not a spinning fit specialist, so I don't fit people for their spinning bikes, but I know some of the basic premises of what's going on here and some of the mechanics. So one of the big things, especially with spinning and any repetitive sport, running, bicycling, swimming, anything like that, good form is important because bad form has a tendency to multiply on itself. So you can take small problems and make them much larger problems the more you pick at the proverbial scale. So spinning is definitely one of those activities, and you want to make sure you're obviously using the right equipment, you have a proper bike fit, as well as good footwear, and so on and so forth. Now, plantar fasciitis is not nearly as common with a lower impact sport like cycling, but it is out there and it can happen. And one of the reasons it does happen is because of a lack of mobility, because a lot of things have to move together. So this next segment, I'm going to show you kind of like how those mechanics are important for protecting the plantar fascia and how to help remedy some of that. So I talked to a couple of my friends that actually are really big into spinning, and I asked them, what is one of the more critical aspects of a bike fit as well as the form when you're on a bike or in spinning class? And they said proper bike fit is obviously is important, but setting yourself up for the downstroke, okay? Being when the foot comes around to then push down to then give you that oomph when you push. And they said that's one of the more critical spots where problems have a tendency to compound. What they told me is that if you're spinning and the leg is coming up, that once your foot should be at the top of your stroke, and the foot is roughly pointing at 3 o'clock, the knee should be about over the big toe. Excuse me, the ball of the foot. So it should be kind of right here where my pinky is. So then you can get that kind of kick around as you're pushing through. And too high, there's a tendency to put not enough emphasis through the calf muscles, and then too low, you're just not getting the same power, and you could be putting a little bit too much stress through the knee. So I was looking at those mechanics, and it would make sense. As I had mentioned in my last episode, having this ankle mobility is quite important. And in cycling, I think it's just as important, because if you think about it, when that leg comes up, okay, and you're in this position, you have to have a fair amount of ankle dorsiflexion. You should be able to get to that 15 degrees. And if you can't, where is that 15 degrees going to come from? And more often than not, it's going to collapse this arch down, because if the ankle itself can't get to this direction, then what will happen is that arch will start to collapse a little bit, okay? And if that arch starts to collapse, you're losing mechanical advantage at the foot. And you can actually try this for yourself. When you're standing on both feet, if you come up but allow your weight to kind of move kind of towards the outside of your toes, you'll feel like it's actually pretty easy, because it's got that good mechanical lever. It's got that nice firm lever. But if you then try to go up on your toes but over the ball of the foot, you're going to start to feel a lot more pull kind of at the bottom of the arch here, because as your foot naturally comes up, you supinate out, and that keeps the foot in a firm position. But if you're coming out over the toes, that foot pronates, and now you're putting a lot more stress on that plantar fascia. So if you're lacking that ankle mobility kind of through this critical point, you're then going to be relying more on that plantar fascia for the downstroke. So you're not going to get that bony lever. You're going to have to use the muscles of the foot and the plantar fascia of the foot, basically the stuff that likes to break down and not heal very well, because you're losing that mechanical advantage. And we're going to take a look, because there's actually one other thing that can happen with bicycling and kind of lead you to believe that it may not just be an ankle thing, but it could also be a nerve thing. So we're going to take a look at that real quick. Okay, so you've gotten all your gear checked out. That's all good. You've been properly fitted for your bike. Your thighs are not going past parallel when you're getting ready to enter your downstroke. Ed, you've gone to your physical therapist, they've done that Taylor swing test and noted that you have full ankle dorsiflexion and mobility, but you're still dealing with plantar fasciitis. So what else could it possibly be? There can be a nerve component to this. And an interesting thing, especially with spin class or biking, for example, is that there's a sitting component to it. And when you sit, you can put a fair amount of stress on the sacroiliac joint. Now, before I go further, if you haven't seen episode 1, where I'm talking about gluteal muscle strength, the same basic principles apply to this as it does for the glute muscle. So if you haven't seen episode 1, definitely go back and see episode 1. But if you're dealing with plantar fasciitis, obviously the plantar fascia is overworking. The joint's doing its job, but something else is not doing its job. And if you're getting S2 irritability, sacroiliac joint irritability, this S2 nerve right here actually hooks in to your foot intrinsic muscles, the muscles that sit under the plantar fascia, deep to that plantar fascia, that help support the arch. If those muscles are starting to weaken, number one, it might actually not even be plantar fasciitis, because there's another muscle in here called your quadratus plantae that sits kind of on the outside portion, or excuse me, the inside of the instep of the foot, that can start to break down. So the plantar fascia may not actually even be the problem. It could actually be that muscle. And I've seen people with that. I've done dry needling and it gets better. But again, why was that muscle weak to begin with? Well, if you can trace it back up to S2, this guy up in here, if there's a sacroiliac joint problem, it's going to start to affect the muscles of the foot. So in order to get that to work, you correct the SI joint problem if it exists and get that better. And that should help improve the stability of the foot through those muscles. But there's a nice little tip here. If you're in a spin class and you're dealing with plantar fasciitis, note and see if you have increased hamstring tightness on that same side. So if your left foot is the problem and you got through spin class and you're having pain at the foot, check and see if your left hamstring's tighter. And the reason why I ask that is because there's a common thread. The common thread is that S2 nerve. Not only does it hook up into the muscles of the bottom of the foot, it also hooks up into those hamstrings. So if you're dealing with tight hamstrings on that same side as your plantar fasciitis, the common thread there would be that S2 nerve. So you can stretch, you can roll out, you can do all that wonderful stuff, but unless you're taking care of what's antagonizing it, you're not really going to get to where you want to be. And these are the little things that you would want to see. So have your physical therapist correct the sacroiliac joint problem, and then retest the muscle strength and see how it goes. I'm Jason the PT. Thank you for the questions, and I'll see you at the next episode.